topping the headlines this morning. The Washington Post talking about how President Obama's initiatives are hitting speed bumps on Capitol Hill, mainly because of money. Obviously, you've seen the polls. Americans are growing weary of the federal government having more power over private industry, and also the issue of deficits. Suddenly, almost overnight, becoming a front burner issue in a lot of these polls, and NBC News Wall Street Journal poll shows that over 20% more Americans would rather the government worry about deficits than stimulating the economy. How do you, the Democratic Party, and President Obama pass an initiative, let's say, as large and sweeping as health care?
I think the first thing that the president has done a good job of doing is to reassure the American public that it's not his or his administration's intention to go out and seize General Motors. General Motors collapsed and fell into his lap, and the choice was, do you do something to keep it going, or do you allow the American auto industry to disappear? So there's not a lot of voluntariness about our role in some of these things, and I think that's important to emphasize. On health care, I think the American people know very clearly that this health care system is not serving them well and is not sustainable. Every family has a story about a loved one in the hospital who they had to stay with because they couldn't trust them there alone, about the 25% increase that came to their small business, so they had to cut off their employees, about the medical error that left their grandmother in the hospital for an extra 2 months because of the hospital-acquired infection, and about the fact that they can't get their wages up.
So how do we reform this system if we don't have, if Americans don't believe we have the money to do it? Where does the money come from?
Well, no,
and how big is this?
Not even Americans. No. We don't
have the money.
We don't have the money.
Well,
even the president.
Let's put it into context. In the next 10 years, if we don't do anything,
yes,
Americans are going to spend $34 trillion on health care.
Here's the problem,
and
though.
we have the chance to save $700 or $800 billion a year by reforming our health care system. You can't reform something as big as our $2.7 this year trillion health care system a year without some investment to make it change.
I understand that, and
we have to do that.
I think that sounds like good intentions. I think we might be running politically into a credibility problem. The Republicans had one when it came to spending, and I think the Democrats are developing one, because we keep saying catastrophe, catastrophe, spend, spend, spend. At some point, people are going to stop believing that it's a good idea to live on a credit card, and we're seeing that in the polls.
I think it's true, but I also think it's true that there are times when you have to spend a little money to save a lot of money, and that is the circumstance that I think we're in healthcare right now.
CBO said, okay, well, it takes $1.6 trillion, and we can insure 1/3 of the uninsured. And apparently even Barack Obama said, come on down to the White House. We're not going with something like that. What is going on?
Well, I think it's part of the standard process of legislation where you put the bill in, CBO comes in with a number, everybody gets astounded, they go back, they work with CBO, and you continue forward. I don't think that's all that dramatic. I think there's an additional fact on the table, and that is that the CBO calculations only look at the cost side of the ledger. Doug Elmendorf will say, look, we know that there are savings out there. We know that there's substantial savings out there. I just can't predict them. I can't give you a firm number.
But we Republicans used to say that about the CBO when it came to tax cuts. And the CBO ended up usually being right, that the deficits would explode. Maybe you can help me out here. Because we've been hearing for some time.
Hold on that just 1 second. Nobody in their right mind could possibly believe that the American health care system couldn't be made a lot more efficient.
Yes, but nobody in their right mind, Senator, and this is the Democrats' problem, nobody believes Barack Obama gives a damn about deficits. Not after the way he has acted over the first 5 months in the White House. And when the president goes out there and says we're out of money, and then he says, oh, by the way, we're going to spend a couple of $1 trillion on health care, because guess what? Health care costs too much. And nobody, and this is, maybe you can help me out here, because I want to be educated. Maybe you can explain to me where the $1.6 trillion goes to take care of the big issue. and that is exploding health care costs over the next 10 to 20 years. Explain to me, and maybe you can convert me today. We can sing Just As I Am. I will walk down to the front of the church and be converted. But no, nobody can explain to me how does spending in a system that already spends more money per person than any other healthcare system in the world, how does spending $1.6 trillion save us money in the long run? Break it down for me. Convert me right now. Right now.
Me
okay,
too.
That'll be difficult.
Let me start with your first point, which is that I don't think it's completely fair to say that President Obama never saw a spending he didn't like and has no interest in the deficit. He talks about it over and over and over again.
He talks about it, yes he does.
Remember what he walked into, and remember the fear when this started that there was going to be a global economic meltdown of a type we've never seen
Senator,
before.
let's save everybody a lot of time. As I've said, I'll give you the first 2 or 3 years. Spend as much money as you want on stimulating the economy, but it's a CBO and everybody else that I read that say the out years are what cripple us. The healthcare out years. It's not the stimulus plan. It's the out years that kill us economically. So let's figure out how does spending $1.6 trillion on healthcare reform now save Medicaid, save Medicare 10 years from now? And I'm serious. I would like to know, because the president hasn't explained this.
I understand.
And by the way, if you can explain that to me, I will tell you $1.6 trillion is a bargain if it can save Medicare and Medicaid over the next 20 years.
Good point. There are two things going on. The first is we have 47 million Americans uninsured right this minute as you and I are sitting here. And during the course of this year, it's going to be nearly 90 million who will be uninsured at one point or another.
Right.
And the weight and the pain and the anguish of that on families is considerable.
Understand.
And the 1.6 trillion goes to knocking that number down. That, I think, needs to start now. And because we know that people will come onto the healthcare system, and because CBO has guessed that some people will move off of employer-sponsored health care into the government system, that number gets big. A good portion of that number is actually savings to the business community from the transfer over. So it's not a net drain on the economy, but it is an additional health care expense for those families.
But Senator, you do understand it's two different things. So you've got the 47 million Americans that are uninsured.
And then you've got to fix the system.
Right. And so you've just, I think, made my point that we're talking about the 47 million that we want insured, but that does nothing to slow down health care costs over the next 10, 20 years. It's two separate things, and it doesn't address Medicare and Medicaid.
What slows down health care costs is investing in quality improvement where it can be shown to save money, which is all over the place. Investing in a health information infrastructure for our country. Investing in illness prevention where it can be shown to save money, which is all over the place. Investing in reducing the administrative cost of all the insurers having all their own paperwork, and letting people know a little bit more about what the system is around them, consumer information.
Well, Senator, I'm still on the back pew, and so is Buchanan.
We'll bring you forward over the next couple of months.
And you know what? The way you bring me forward is showing, again, I'm not arguing that the 47 million Americans that are uninsured don't need to be insured. I think they do. But even if you insure them, Medicare and Medicaid still go bankrupt 10 years from now. And we still have the health care cost explosion overall that cripples this economy. And this program you're talking about, and taking care of the 47 million Americans who are uninsured, these are two separate things.
There are two separate things.
There's a moral dimension, I understand, with uninsured, but there's also a fiscal dimension about making sure we don't cripple our country in the long run.
You've got people overboard in the water. You've got to bring them in the boat. You've also got to make sure the boat's not on fire and will go forward.
Here's the problem,
and
Senator.
Delivery system reform is what will fix the boat.
The boat? It's sinking right now.
That's why we've got to fix the boat.
You pull those 47 million
all those people in, we go under.
Delivery system reform will fix it.
All right. Senator Sheldon, Whitehouse.
Okay.
No, it was a good conversation.
Oh, it's a great one. And we didn't even get to, we wanted to talk about Afghanistan and
We're going to have it back.
We'll get you back
another
time.
Thank you very, very much.
Great pleasure.
All right, coming up, Pulitzer Prize winner and Washington Post columnist Eugene Robinson. You're watching